I'm here in Los Angeles, California to speak with David Law. When David's daughter Violet, who passed away late last year, was diagnosed with GM1 Gangliosidosis, he dedicated himself to the mission of finding a cure and raising awareness. Through fundraising initiatives, public speaking, and community engagement, David has played a pivotal role in mobilizing resources and support for the CureGM1 Foundation, where he serves on the board. His efforts have raised over $250,000 for the CureGM1 Foundation and helped pass 2 state California resolutions for GM1 Gangliosidosis Day recognition. Hi, David. First, thank you for speaking with us and sharing your story. Tell us about yourself and your journey with Violet.
Thanks. Thanks so much for having us. So my name is David Law. I'm a physician and the father of Violet Aurora C-Son Law. She came about in 2019, and unfortunately that's when the pandemic, right before the pandemic happened. And me and my wife are both physicians, and working through the pandemic, it was very stressful for all of us, and we went through a lot. And coming out of it, we wanted nothing more than just to, just be with our child and raise her in the normal way, Unfortunately, that wasn't to be. Soon, as she approached her first year of life, my wife, who's a pediatrician, did notice that she started missing some developmental milestones, wasn't crawling appropriately, wasn't babbling the same way other kids were at that age. And unfortunately, we got the diagnosis of GM1 Gangliosidosis in 2021. And it was devastating for us. Even being in healthcare, we had no previous experience with this disease. We had read about it probably a couple times in medical textbooks. Even this whole class of diseases, leukodystrophies, we didn't know much about. As we found out, there was no real treatments or curative therapies. It was all just supportive care and essentially end-of-life care for a child, In the years that we had with Violet, we really spent times just really trying to enjoy life. It was very clear early on she didn't have a lot of ability. She plateaued very early on. And yet, our days were filled with being with family and going to Disneyland trips and, being happy and just really spending time, with her friends and loved ones, Violet even got a point to go to preschool. We found a special education program near us, and she got to have a class and got to have classmates and everything. Our entire community came out really strong for us. They truly we started a GoFundMe campaign. Started first for doing some raising awareness and research with a goal of $10,000. After the first week, it had blossomed to more than $50,000, and after that, almost more than $100,000. To this day, the GoFundMe is more than $250,000. And donations continue to come in, and I think from that, it really spurred us to see that in dealing with the very day-to-day care of our child going through all of this, we also have now a voice in advocacy and bringing awareness and doing something for this disease population. Around this time, we got involved with the CureGM1 Foundation, which is the only nonprofit that's dedicated towards finding a cure for GM1 gangliosidosis. I thought with my medical background and everything, I thought, I'd be a good voice on that. And so I joined the board of that eventually and helped the advocacy in that way.
One of the challenges we often hear from families is the difficulty finding a provider who can not only help them find a diagnosis, but also has the time to become an expert in their child's condition. As both a physician and a parent, how has your personal journey impacted your role as a healthcare provider? And what advice would you give to parents that have recently received a rare disease diagnosis for their child?
Coming from a clinical standpoint, I understand even more importantly the role of a physician-patient relationship and how that, even a physician-family relationship, because that advocate for you can really go down pathways that, other practitioners might miss. So many families are embarking on this diagnostic odyssey that takes years to even get a diagnosis, and for so many that's too little and too late. I think we just have such a much more in-depth experience with the United States healthcare system, from physical therapy, home therapies, from multiple specialties, from primary care, from everything, It makes me that much more of a compassionate healthcare provider and makes me want to spend that time, because I know it affects so much more on that personal level when you can connect that way. I think the advice I can have for families is, your child the best. You've been around them the entire time. Listen to what's going on around you. Seek out trusted allies and professionals, and just don't give up.
In addition to your advocacy as a physician, it's our understanding that your personal talents of both music and running have helped raise significant funds to advance research in the hopes of finding a cure for GM1. Can you share a little bit about what Cure for Violet Music Festival was and how you balanced your life, work, and leadership and advocacy?
But one of my good friends, Ronnie Exley, he organized this Cure for Violet Music Festival where we took over a music venue here in LA for a night and essentially had a lineup where we played music and essentially raised funds for the CureGM1 Foundation. Grief truly is a shared process, and I think when we had that kind of event, we were also able to celebrate with each other and to really donate our energy into doing something productive and meaningful. I think having that balance, you work for it, but when you have that, everything improves all around. And I definitely think that when we had this balance of, both the clinical stuff, advocating for Violet, but also through the fundraisers, through the marathons, through everything else, having these things also rounded out this whole picture that constituted the care for our child.
So where are you headed from here? And what is your hope for the future of the GM1 community and the work of the CureGM1 Foundation?
Personally, there's been so many resources, so much advocacy done, so much work, and so much that I feel like Violet's life has to give, even from how it ended so suddenly, that it'd be a shame not to push forward. This disease has no therapies and no cure. And that's so devastating for so many people that when they get the initial news, they don't know what to do and know what to say. Part of our voice in advocacy is being healthcare professionals and being clinical. We can lend our voice that way, and even in outreach, education, and let these people know that there's a way forward, even though it's not as, not what you thought it might be. The advocacy doesn't stop, and we do it now for the other kids who have GM1, for the other rare disease patients out there, for the families, and of course for our daughter Violet.
So David, what does a 2024 Torch Award mean to you?
I think it is definitely a commitment to just advocacy and going forward, and a promise for not just GM1 kids, rare disease kids, and for me, for Violet, personally.
David, I want to thank you and your family for your time today and sharing the story of Violet and her beautiful life and all that you and your family have done. You have made such an impact into the lives of so many in the time that you've had with Violet, and there will be a bigger impact, I'm sure, beyond, given what you have in store for the future. But I wish you the best of luck in your family, Vina, Derek, and everything in Violet's memory. So thank you so much.
Thank you. Thank you so much.
We're so grateful for David and his family for sharing their story and their journey that they shared with Violet. At Sanofi, we've long partnered with the GM1 and GM2 community and have seen firsthand their resilience and dedication. And while the science proves challenging with these conditions, the spirit of the community is undeniable.